when you hear your child has a sudden medical diagnosis or a sudden trauma. Life as our families knew it has undergone a drastic change. One of our goals is to help them navigate that phase of that journey with support, with compassion, with clinical expertise, but mostly with hope.
The children who come for care at Blythedale, they have really, really complicated medical problems, and they need those medical problems managed, but at the same time, they need comprehensive rehabilitative therapy. Those tend to be children who come out of a neonatal critical care unit and have diseases and injuries largely related around issues that they were born with. Unfortunately, some children have problems associated with a disease they've acquired as they've gotten older, and some children we take care of have had traumas that will require complex care.
You've got your medical and your nursing and your clinical care team that is really experts in navigating that part of the healing journey.
A child wants to be a child even when they're sick, so we need partners to be able to help play become part of recovery.
Our therapeutic and developmental support services is a collaboration of 3 very specific disciplines in the hospital. It's our child life team, our therapeutic recreation team, and our music therapy team.
TDSS, they're a piece of the puzzle, but they're also that fabric that's kind of woven through every discipline that complements and kind of pulls it all together.
Our ultimate goal of our services is to ensure that we provide a diversified approach to coping and support for our patients and families.
You've watched your child linger in an ICU, fight for their life, and then they're able to come to Blythedale and begin to get their life back. And one of the first signs I think a parent will know their child is back is when they see them play.
To the outside, if you were looking in, it just might look like fun playtime, but it's really very customized and intentional to meet goals of care.
Play is such a universal language for kids. There's so much underneath those interventions that we're supporting. Sometimes it's just to normalize, but other times it is to help them get through some of the tougher things.
John and I were home playing video games. Next thing I know, he was crawling on the floor and he started screaming, "I can't see."
John suffered from an arterial venous malformation, also known as an AVM rupture. It affected his cerebellum, which focuses on all motor function movement in his body.
The neurosurgeon told us that he is the sickest child in the hospital, and there's a very good chance that he's not going to survive.
When he arrived, he was in a coma, and then slowly over time, with the complex care that we can provide, we were able to help his brain recover.
He needed a lot of support from our child life team to navigate through procedures, helping him and his family with the stress of blood work, trach changes.
John's passion is toys. They will guide him to a class of toys, and then they build a therapy around it. They come up with new and exciting things for him constantly, and it evolves with his progress.
His resilience is just on another level, and he went from having very limited to no motor functioning to now where he's just moving, he's dancing, he's speaking.
When he got here, it was a lot of trying to figure out how he was going to communicate with the world around him, how he was trying to express himself. And in music, we can work on ways to express ourselves.
When we arrived at Blythedale on Halloween, which was always John's favorite holiday, there was a parade and there was music and just joy through the halls. I was kind of beside myself seeing all these children that were battling their own issues. It just brought me hope and made me feel a little positive. I remember when I got to the room, I just sobbed. Miss Risa came in, she sat on the floor at John's bedside, and she just calmly started singing Bob Marley's 3 Little Birds. I was sitting there and I started crying. And she told me everything's gonna be all right.
Singing, don't worry about a thing, 'cause every little thing is gonna be all right.
Music is so much a part of John and I's life. We danced all the time. Having her there kind of brought that all together.
Wave hello to Genesis. Ready to practice? We wave our hands back and forth.
Genesis was born at 30 weeks. We found out that Genesis had a condition called CDH. She was born without a diaphragm, That meant that all of her organs went up into her chest, which didn't allow her lungs to grow. That required her to be intubated and also needing a trach.
What we're going to do slowly over time is help Genesis' lungs to grow and develop, support her heart as it's recovered from surgery, and allow her nutrition in her body to grow. Genesis is on a mechanical ventilator, but at Blythedale, that doesn't stop us from letting Genesis play and grow and reach for a ball.
After coming to Blythedale, we were able to see past the trach and the feeding tube and all of that. We got comfortable enough that we were able to see our daughter for who she is. And little by little, she was reaching these milestones where she got to go to baby school. And you were able to see how happy she got.
When a child is hospitalized, it affects the entire family. And we really want to work to support the coping of the family, and especially if there are siblings at home.
When we first arrived at Blythedale, I was very concerned for my son Lucas because for most of the time he was left with babysitters and family members. He felt, I guess in a way, left out. And he was also going through a hard time and didn't understand why mommy wasn't there. Child Life helped me explain to him in his terms, in his way, how Genesis will need these extra requirements.
This is all foreign to many children that come here. They will see all sorts of things like tubes and machines and nurses and doctors. So we really want to work to make it an experience where the child feels comfortable and the parents feel comfortable bringing the sibling here.
We will work with families to try to conceptualize for themselves, for the child, for their siblings, on what is happening.
Sometimes hospitalizations can result in significant emotional traumas for kids. How do we take them on that medical healing journey while also being mindful of their emotional response to it?
One of our main goals is to ensure that we don't let life experiences pass us by just because we're hospitalized.
We really like to make each child feel so special with any celebration that we have here. We try to personalize in as many ways as we possibly can in order to make them feel like they are seen and they are understood while they're here.
We also run events. It could be holidays, camp weeks, things like that.
It's their personal engagement with the children that makes them so special.
It's just like a magical place where everyone is just your cheerleader.
Kids are not supposed to be hospitalized. This isn't supposed to be part of their journey in life. They're supposed to be outside playing and enjoying their lives. It's really important for us to bring this feeling of fun and normalcy. Do you remember the first time we met?
No.
Oh, you don't? I do. I came into your room and you were watching a show.
Oh, I was watching Shameless.
You were watching Shameless?
Uh-huh.
When we first hung out, what did we do?
We played Uno.
Yeah.
Peyton was a victim of gun violence. He sustained a gunshot wound to his neck that injured his spinal cord, and he suffered some temporary brain injury. Each day seems to bring a little bit of progress for him.
When I started working with him, I really wanted to just ease his experience and meet him where he was at. And so playing some games that he likes, like Uno, really created this bond between us that supported his overall coping during some of the more difficult pieces, like his trait changes, helped reduce his anxiety while distracting him. That actually helped increase his oxygen and decrease his heart rate.
When I'm sad or depressed, she helps me get through that. Like, she helped me get through a trait change, taking my mind off stuff.
Peyton is a really resilient kid who loves to use a little bit of humor in order to get through his day. You didn't talk about how funny I am, but that's fine.
Nah, she's funny. For sure, she's funny. She is funny. I can give her that.
Having the medical pieces being identified and supported is so important, but also having the psychosocial pieces be supported as well is so crucial in the overall child-centered approach to care.
Without these resources that are not reimbursed by insurance, you're missing a whole piece of the healing endeavor that we've set out to do here.
These children come to us with such broken bodies, and we're helping them recover. We want them to recover the magic of being a child, and that magic is about play and joy and laughter. Supporting Blythedale is supporting that child's recovery.
If we are really committing to our families, telling them we're going to give you the best possible clinical, psychological, developmental support team, we need help. We need help funding that.
We're able to find all these beautiful people that not only are doing their job with their heart, but also truly caring about us. And it feels, we keep saying this, like home and family.
I feel that no other hospital is like this. It's worth the travel of 2 hours. Even if it's 3 hours or 5, it's worth coming here.
Despite the distance and everything, I wouldn't have my daughter anywhere else.
People genuinely care and genuinely want to see you succeed. From the people who keep this building running, to the people who directly care for your child, to the therapists who got him walking again, to the NAs who sang lullabies in the shower when John was scared in the beginning. Blythedale has left an indelible mark on our lives that we'll have with us forever.
That's a wrap.